Before we close out the discussion with our final discussion on next steps, I have a few questions from the audience or comments. I beg your indulgence if I misunderstand your question or can't read it. Please feel free to correct me, wave your hand and say no, and whatever. But my apologies if I butcher your comment or question. The first one follows on legislation. I think it's suggesting that we need legislation to help people with mental health illness. And the question is, if someone goes off their medications, they can't get help. But if as a result of that, they do something that, the suggestion here is violent, they get help. What can we do to change that? Is legislation the solution?
That's not quite right.
I think I butchered the question.
Yeah, just a little bit. Hi, Juan. Juan knows of my situation. I want to know why it takes 1.5 years to get someone help in this country. Why, when someone goes off his medication, that there is no help. I want to know what legislation we need to put into place to help people in this country with mental health issues. It is beyond ridiculous that I have to wait 1.5 years to get help. This man has to become violent in order to get help. I cannot understand. Maybe it's the same in the rest of the world. And he was held at Maui for 72 hours. And I was told he was psychotic, but yet he could be released. What is wrong with our legislation?
Do any of the panelists?
I'm sorry if I'm not mad at you. I'm just mad.
You mean legislation in respect of the medical treatment? Is that
Need legislation if someone is unaware they have a mental illness, is refusing to go on their medication, is destructive, in my case, to a business, to a life, there is no help. There is none.
Thank you. Hi, I'm very sorry to hear what you're saying. I'm a defense attorney, and I am generally the defense attorney for the Mental Health Treatment Court. One of the problems is that under the current legislation, somebody has to become extremely ill before anything can happen. But our Mental Health Act is, I think, 2 acts old compared to the English legislation. The English legislation has changed twice. And we're very, very far behind. In England, I think they have a thing called a residential order, perhaps the lady over there may know, which is where a court can order the person to take their medication. If they don't take their medication, then they get told that they have to go back to somewhere like MWI and stay until they have taken their medication. It doesn't have to end, it doesn't have to rely on a criminal activity before they're forced to take their medication. It's, but we're very far away from there. Our act, as I say, is very, very dated and needs to come up to the modern era, really.
I'm afraid I can't, Karen, I can't offer you solutions. I only can share in your frustration. Saul is right. Our Mental Health Act is extremely archaic. It doesn't allow us to do a lot of things. As a magistrate, as a member of the judiciary, I only can follow what the law tells me I can do. I think that the way it's presently drafted, it requires too many hoops to jump through and hurdles to get over before we actually can commit someone for treatment who actually needs it at this time. You know, when a person with mental health illness has an episode, we can't wait. At least the courts can't wait. But you know, the requirement to get 2 psychiatric reports and so on and so forth is very sort of protracted. And we need to have a total revamp, I think, of the mental health legislation to allow us to do an expensive array of things, not only in terms of giving the courts the power to commit someone, not necessarily to prison, because I don't think prison is a place for it, but to a place, an institution where they can get the help that they need immediately, and not just for 72 hours, for a longer period of time. In terms of compelling someone to take medication, I think there may be some human rights issues there, because that's more of a forcing a person to take medication. So, but I think it's worth looking at, and I don't know what they do in other jurisdictions. But it's going to require the political will to get it done, and get it done quickly, because there are people who do not get the therapeutic intervention that they need when they need it, and we need to change that from a judicial point of view. And we have been crying about that for quite some time from the bench.
I just want to also make a comment about this, because I'm Jody. You don't know me. I worked in mental health for about 7 years, got my grad degree in it, moved to Bermuda, and decided I didn't want to do it in Bermuda. The system here is very flawed. And in the United States, in North Carolina, where I practice, individuals that have a breakdown or an episode become violent, police are called. The police in North Carolina are trained to deal with them clinically, basically. And they get them to the mental hospital, and that person has to stay there until deemed fit to go back into society. If they don't have a place to stay, they would stay to the hospital until myself or my case managers found them a place to stay to make sure that they stayed on their medication. And if they were found to be off of their medication, that they get readmitted. It's very different in Bermuda. So yes, I've had a lot of cases when I was working in mental health in Bermuda, where individuals would go to jail and clearly would damage property and have a major breakdown or episode, go to jail, and I'm talking with the correction officers that are not well-versed in these issues, and I'm trying to get with the counselors that are there, and I'm letting them know before this person can come back to live here, they have to have a medical treatment, mental treatment. And okay, this one particular client had to get arrested 4 times. 4 times. Go through the whole court process, go back to jail, she needs help, okay, we're gonna help her 4 times until she finally got admitted. And that was with a very supportive family. Her father was like, please help me get her somewhere. So there's people that don't have that father or that wife or that person that's going to support them and help them get the help that fall through the cracks. So just wanted to say that we do have that flaw, and I've experienced it when I ran the low-income housing at Bermuda Housing Corporation. So it is something that is absolutely needed.
Sorry. I was just going to add that in England, the ability to force people to take medication has been challenged in the European courts to do with the human rights issues, and it has withstood the challenges. That legislation has withstood the challenges. But of course, until we have people with mental health protected in Bermuda, we can't do anything. I mean, that's the first step. Without that, we are discriminating against them every day. They are not equal. They are regarded as a lesser being because of their mental health. So that's the first step. It's essential that it's added into the Human Rights Act.
I just wanted to say a few words about the law in England. I'm still an approved clinician, which is a psychiatrist in England who's been trained to be used for assessments under the Mental Health Act. And we had a lot of debate about the community treatment order. And there were a lot of psychiatrists who wanted to be able to administer medication in the person's home. There was then a debate about who's going to do it. So who's going to hold the patient? Which room will you do it in? What will you do with the family? Etc., etc., etc. So the law is actually that it just allows recall. So they get recalled to hospital. Then they need to be assessed. But I can see that that is much more advantageous than not having recall. But that's where the law is at the moment in England. I'll just say one other thing, just to throw a little bit of a wider picture in this. There was some research looking at forensic psychiatrists who, practice as forensic psychiatrists probably for 30 years. From becoming a specialist in the UK to retiring, it's probably 30 years as a forensic psychiatrist. And the question asked was, how often do they get it wrong? So how many years are people locked up who shouldn't be locked up? And it's an interesting question. And there was a number, and I don't know the number, but there's that tension as well about being too ready to restrict and contain and take people in. And it's about finding the balance, and it's a very difficult balance, but I certainly appreciate that there could be much more done here as far as the law is concerned. As a child psychiatrist, I mean, I'm very lucky. I very rarely find myself in that situation. I mean, we've used the Children Act and occasionally the Mental Health Act, but it's much easier for me, and I don't have those dilemmas.
We're talking about next steps, right? Not yet. Oh, not yet.
I have one more comment from the audience, and again, I beg your indulgence because I'm sure I'm not going to get this right. This comment, I have two actually. This comment boils down to a person cannot report abuse. The mandate at Mid-Atlantic Wellness Institute is they do not get involved in disputes. And I think the questioner really wants to know, how do we get around the barriers to institutions, mental health workers getting involved in giving treatment to individuals as we've just been discussing?
Can I come in on that? I mean, I'll just give you a very quick example. I recently made a referral to the Department of Child and Family Services because a teenager patient service user had disclosed physical and emotional abuse. Anyway, later on, the father came to me and said, why didn't you tell me, why didn't you speak to me about it before you did that? And I tried to explain to him that my duty is to report allegations that are concerning, not for me to establish the validity thereof. I'm a doctor. We are nurses and doctors and service providers. We are not investigators. We don't have the teeth to do that. And I've had lots of parents very angry, and they say, oh, you never even told me, or you never asked me. That's not the responsibility. But that's from a child and adolescent perspective. I presume it applies to adults as well. Well, as a doctor's duties, I'm saying, I don't think the doctor's duty is to decide who's telling the truth. I have no training in that. You see, I think that's a legal question.
Make it a quick statement. It's based on personal experience. I went to Maui to report that I was being abused by someone. When they realized that it was a family member, they told me that they don't get involved in family matters unless it goes to court. And what the doctor basically confirmed to me, and Maui has routinely said this to me over the past 2 years, and in this instance, I said to the doctor at the time, I said, are you telling me that I have to go down the road first, hit the person in the head with a brick, then go to court, then you'll get involved to find out what went wrong? And he says, yeah, I'm sorry, that is the way it is. And to me, I think that's problematic, especially as people become more aware of what their rights are.
I mean, I think just quickly, and then I'm going to pass this down. I mean, I think, personally as a doctor, I think, the Hippocratic Oath, first, do no harm, and then, second, comfort, and thirdly, try and cure. That's the Hippocratic Oath. So to do no harm to me means that when I believe someone is being harmed, I need to do something about that. And if that's a telephone call or a fax or a report, I need to do that. That's how I understand the Hippocratic Oath.
I think, again, it's unfortunate that you had that experience, and I think we are developing a theme that we have lots of gaps in our legislation and things that we can do as healthcare providers to help people access their services and to protect individuals. Because from my training as a psychologist, we have a duty to report child abuse, out or out abuse, but we don't really have those duties with adult to adult abuse. And so, those do become issues around, domestic violence and where do people go to get that assistance that they need, where we don't have that legislation where we're obligated to report that. It becomes a choice of the individual.
Okay. Thank you. I have one final comment question. And the question really revolves around substance abuse treatment and treatment for mental health conditions. Are they related? Are residential treatment facilities equipped to deal with both diagnoses? Are they equipped to provide real support and help? And I don't know if there's anyone here from a drug treatment facility, but we'll certainly take advice from our psychologist.
I don't know who else is here, but I provide psychology services for the Turning Point Substance Abuse Treatment Agency at Mid-Atlantic Wellness Institute, and this is definitely an area where we have lots of gaps in being able to provide effective care for our duly diagnosed individuals, and this is definitely where mental health court has been helpful as well in helping us identify where we need those services. Within substance treatment alone, I think we still are lacking in many services. The number of inpatient, number of residential treatment beds that we have, the broad range of services that are available to people, and then when we add on that extra component of mental health care needs, then I think we do find ourselves sometimes stuck, in trying to look at how we can provide support to our sister agencies to be able to effectively treat individuals with duly diagnosed issues. Ideally, we need to be treating them simultaneously, and that doesn't always happen as effectively as we would like.
I preside over drug treatment court, and the biggest challenge in drug treatment court as well as in mental health court is the dual diagnosis. In drug treatment court, sometimes the mental illness does not manifest itself until such time that there's some level of sobriety. And so we go through a period of 30 days, maybe even 90 days, and then we see some of the mental health presentations. And when that happens, we're like, oh man, because we don't know how to deal with it at that point. There is no facility. And the facilities that they do well what they do. But when you sort of add that element of, the other thing, the mental health, the mental illness, or the drug, it's almost as if we become impotent. We just don't do anything. And so we try to be creative, but there's really no facility or no treatment programs that deal with that specific category of persons. And that is a huge gap. You're absolutely right. That needs to be filled. There's a huge lacuna.
Keeping in mind that the purpose of this discussion was to convert each of you into champions for mental wellness and for warriors to go out and battle the stigma and the myths that exist in our community and to change our community into one that's understanding, intelligent, well, we already are, and helpful. So with that, I'll ask the panelists to talk about what needs to be done to change perceptions, attitudes, and to improve the services that we currently have and to plug those gaps into those deficiencies. An open-ended question, but they'll be brief, concise, and to the point.
Speak to your children and make them aware. Just that's one of the things I think is so critical, is at a young age talking to children about mental health, letting them know that there's, creating a safe dialogue for them so that they can come to you and discuss anxiety and be able to recognize anxiety, depression, obsessive compulsive behaviors, That is a conversation that needs to constantly be had and a relationship that we need to build with our children. I think that would be a huge start, making them think of mental health and wellness the same way they do with physical health and wellness. Mommy, my tummy hurts. I feel sick. You know, they should be able to come to you. And they may not always be able to verbalize what it is that they're experiencing. But you need to be able to have that relationship with your child. For me, that's a huge thing. And I think that moving forward in generations, if we're able to increase that dialogue, we'll see changes in our adults.
Let's continue to talk to our children. Let's continue to talk to our churches. Anyone that will listen. In fact, even if they don't listen, let's continue talking. But most importantly, we need to talk with the people on the Hill, because until the law changes, we're just going to be spinning our wheels in the mud. Because after you tell the child about anxiety, about depression, about bipolar, about schizophrenia, they're not going to be comfortable telling anybody that they have it because they're not protected under the law.
I just wanted to add that there are many different treatment techniques that are out there that exist, and research is just very important, evidence-based research, and going forward, particularly for the population that we're trying to serve, is that we capture relevant research in this area. Going forward, it would also be nice to have some sort of local employment policy in that employees are being supported through their role as an employee, so that they're reaching a level of success in the jobs that they're performing. And I believe it happens in government with performance appraisals, but it doesn't happen. Well, some companies have their own private policies as far as supportive employment, but then there are some companies that do not. So something to that effect. So again, research, a national registry of disabilities, but I also wanted to mention, we're talking about mental disorders, and there are many other sorts of things that can be addressed, that can be added to the disability realm for the Human Rights Commission. Intellectual disabilities is also missing out of there as well, and that's something to consider, particularly with autism and dementia going forward. We need to be prepared as a country for treatments and the way forward, housing, facilities for these sorts of things going forward.
As a child psychiatrist, I'm very pleased to hear people talking about children, and something I think is helpful and with children. Children do spot differences. I think we all spot differences, but children often verbalize differences, and they see people that are different or behaving differently. And something I found very helpful is to say to the child, well, do you think that person chooses to be like that? Do you really think about it? That person is choosing to be like that and to live like that. And that can be the start of some sort of discussion. The other two things I just wanted to say very quickly were high-profile cases are high-profile cases, and they can cause a lot of difficulties. But I guess if there's a high-profile case, there's a high-profile case. And I think it's an opportunity to milk it. And because those are the things that get politicians uncomfortable. So I hope there are no high-profile cases, but were there to be one, I would hope at least half the audience would phone or write or comment or have a discussion at work, because it's a huge opportunity to change things. And that brings me to my third point, and I've wondered about this, about finding a sympathetic journalist that would, from time to time, write something And you know, so you're dropping some ideas into the pool of thoughts, into the newspapers or somewhere. So if anyone knows of a sympathetic journalist, I know people who are willing to write as ghostwriters. So.
Well, I kind of piggyback on what you're saying, because the first thing I thought of was having forums like this, and if people can't get to the forums, then put the information out there. I think if I don't remember anything else, I'm going to remember 1 in 4, you know, because I've heard that so many times tonight. And I think, you know, it's those little things, those little bites that you put out there to the general public. Those are the things that stick. It doesn't have to be monumental in terms of information, but just a short little thing that just says, hey, this could be you, or it could be the person next to you, somebody that you love, somebody that you don't like, but it's 1 in 4, right? Okay.
And we struggle as to how to maintain that, and interestingly, our budgets continue to be cut, and so I question where the priority is, and so I just bounced that as a quick ball, and but then just to say that the only other thing I wanted to mention here was the idea of the caregivers, and how do we support each other in the caregiving. I would hope that a doctor would be well trained enough to be able to know when to balance, but of course you have to professionally know when to balance. But many of our workers on the front line, and some of them are volunteers, where's the support for these people? And the other question that I think about is where's the support for families, and what kind of support groups out there are there? And if I developed cancer today, I know immediately where I could go for a support group. There's the people who have, and not people who are going through treatment centers or anything like that, but people who are struggling with mental health. Do they know that there's a support group out there for them that they could avail of?
If there, one more comment from the panel.
I just want to say that maybe it is probably one of the best well-kept secrets, but we do try and get the word out there that there is a family support group for persons who suffer with mental illness. I have been facilitating one for the last 15 years, and people will come in at the acute phase of the illness, but part of the problem is that when they come to family support group, they see somebody in their neighborhood who didn't know that their loved one had a mental illness. So then they're not coming anymore because they have a fear that the rest of the neighborhood's going to know their situation. So the attendance fluctuates. People who really feel that they can benefit from it, they will continue coming. But there are people, when they see others in the audience, they're not coming anymore.
One final comment.
Because I'm sure everyone here now is going to immediately contact their politician and tell them to immediately change the laws, hopefully Human Rights Act 1981 being one of them. I would say one thing, pushback I've got from politicians is current economy. Current economy means businesses need to be efficient, which means that if we had people with mental disability in the workforce and they had those rights, someone's actually said this to me, that could reduce productivity. And I would just like to say, if you ever hear that, notwithstanding the ethical dilemma and the ridiculousness of the comment as a whole, there's actually provisions within the Human Rights Act at the back of the Act called unreasonable hardship provisions, which protect in many ways employers from having to make adjustments that are unreasonable. So a classic example of that, if someone in a wheelchair needs to have a ramp to access a business and otherwise can be 100% productive, and that ramp costs $25, the employer would be expected to ensure that person potentially could get in and work to a productive level. If that actually cost $200 million or $200,000 or something ridiculous, then the Act wouldn't force an employer to spend that money. And it's quite important because there's a misunderstanding here. There's provisions already within the Act which are already there, which are already set, which will protect businesses to a degree. So that pushback that I get is utter rubbish. And if you get it when you go forward, you should say the same.
30 seconds. 30 seconds.
The final question.
30 seconds. Just keep doing what you do. Keep fighting the good fight. Don't get despondent. Get the impression that maybe we're preaching to the already converted in this room. And so we just have to continue to spread the word. When we started Drug Treatment Court some 10, 12 years ago, there are a lot of faces being frowned and eyes being looked in, and what are they trying to do? But we're at a point now with Drug Treatment Court where everyone is on board, where everyone understands the concept. Police, prosecutors, treatment providers, everyone understands. And so we got to keep fighting. We got to keep doing it. We got to keep spreading the word, keep having functions and forums like this to get the word out there. And in time, trust me when I tell you this, in time, we wouldn't be having this conversation.
Just a final comment from me. I would remind you that as we support mental health services, as we promote mental health, we all benefit. When you're dealing with your hypertension or your diabetes, your mental health is core to improvements in your physical health. With that said, I hope that you will be leaving here tonight with a clear understanding of what the Bermuda Mental Health Foundation is attempting to do, that you are converted to being a supporter and will assist them as they take note of the gaps and deficiencies we've identified and push to have those things corrected. Not having any more cards from the audience, I am required to ask, are there any final comments or questions? And there's one in the back.
The final question with regards to next steps, for me, what's very important, I had a meeting with Mr. Rogers some time ago, and I was trying to find out more information about Mid-Atlantic. And I was asking him some questions about statistical information in Bermuda. Can you tell me how many people suffer with mental illness? Just kind of basic. And we don't have those numbers. And when you think of, from a legislative standpoint or budgetary standpoint, then with financial assistance, there's so many people that's like, we need more money. We need more, but you cannot tell me how many people are affected. we need more services, but you cannot tell me how many people currently are using service or how it's impacting their lives positively, negatively. So I feel like, first step's clearly to get a law passed, but I think that somebody needs to take some time to actually do some research about mental health, mental illness, and those that are diagnosed, misdiagnosed, treatments, if they're effective, like in Bermuda, and the real numbers, and take that serious. So when you do go to your politicians, because I do agree that a lot of them are very ignorant to these social things, I do agree. But I think that, as we all can probably agree, that the numbers and the statistical data will have to, if you're gonna go with 1 in 4, and based on our research, and this is how much money this is costing, but if we had this program, it'll cost less, Oh, okay. He said it's been identified gaps in analytical information, but my point is that I feel like that's probably one of the first and second steps, is to actually get that research so we can get more people's eyes to be open to it. Thank you guys for coming. The Bermuda Mental Health Foundation, as you probably know, because I think we are speaking to the converted, is a private charity that basically advocates for the rights of those that suffer with mental illness. We've recently launched a Rethink Mental Health campaign, which is going to be about a year campaign that's going to focus on combating stigma around mental health, advocating for mental health, doing things like this, panel discussions, and as well as the mental health court to get them some legislation, because 10 years, I think y'all need some legislation. So we're doing a lot of things. We recently have done some school tours. We've been to 3 schools already. It's been phenomenal. I've been very impressed with the the engagement from the students, and they really are getting that this is something that is their norm. A lot of the students are able to say, "Oh, my uncle has this, and we do this to help him," and it's more normal, so I've only been to 3 schools so far. We have about 4 next week, but it's really intriguing to see that the younger generation is looking at this as the norm. They can actually name people that have diagnosis, and they can name the diagnosis, they can name the careers in mental health. So that's a positive thing that I wanted to share, just to say that I think that there's a shift, and I think it's starting from the kids because the older generation was brought up around the St. Brendan's days and it being a stigma. So with that said, I do want to thank our sponsors, which is obviously Cell One. And we also have Aquafina, Tropicana, and Quaker Oats that have joined on board as sponsors. They've been amazing in helping with the school tour. And of course, you guys can reach out, get involved with us. We have a website, bmhf.bm. And we have our social media stuff. And, please continue to support our efforts because we really do want to assist with mental health in Bermuda. So thank you guys for coming. Really appreciate it.